Welcome back. It's just turning 6:18. Today is all about red. All morning long, we've been telling you that we're wearing red for National Wear Red for Women Day. It's all to help raise awareness of women's heart health. Joining us in the studio this morning to talk more about going red for women and heart disease is Barb Dushman, a physician's assistant with Grand Valley Family Health Centers. Good morning. Thank you for joining us.
Good morning.
So what do we need to know about women's heart disease? It's the #1 killer. I mean, this outdoes breast cancer and so many of those diseases that we hear so much about. We don't really hear a lot about heart disease in women.
Right. And, you know, it is the #1 killer. More women die from heart disease than they do from all cancers combined. And most women just aren't aware of the incidence of that. The symptoms are sometimes a little bit different, and maybe that's why women are not real aware of heart disease. But you know, they could have pressure in their chest, in their jaw, in their arms, in their back. They can feel nauseous, dizzy, lots of different things that you think might be the flu, and it really could be heart disease.
Best thing to do with those things is to seek medical advice at least right away?
Especially if you have a risk factor, which is high blood pressure, high cholesterol, family history of heart disease. If you have a waist that's over 35 inches in a woman, that puts you at increased risk. You know, some people just don't like taking medications, but if your doctor says that you need to take a medication to reduce your risk, you should really do that.
You need to take that. You need to follow doctor's orders. Okay, so let's talk about how to prevent it from the get-go. What are some of the things we can do starting at an early age if we're a woman to just stave this off from the beginning?
Eating well. That's one of the #1 things. High fiber, low fat diets, exercise, above and beyond what you do on your daily activities. Trying to get 30 to 60 minutes of exercise at least 5 days a week can decrease your risk by 50%.
Wow.
You know, it's important to have healthy habits.
We know that we shouldn't be smoking, of course. Cut that right out.
Smoking increases your risk by 50%. You can get heart disease 20 years earlier than you would if you didn't smoke. So cutting that out is #1 too.
Be aware of your cholesterol levels, and of course if they're high and the doctor prescribes something, stay on top of that. What about laughter? Really?
Yes. Stress really does can cause heart disease. So laughter just gets it out of your system. You know, it's just something that we really you know, try to promote, that you find things that are healthy and happy for yourself.
It's very good, and that's very easy. You know, it's a good excuse to go get something that makes you feel good. Barb, thank you so much for joining us this morning and giving us great advice.
My pleasure.
Brett?
Good stuff. Thank you, guys. It is